In this activity, we will learn how to treat AC joint somatic dysfunction with muscle energy. The treatment position is exactly the same as the diagnostic position. Let's learn how to treat left internally rotated AC joint. Physician contacts the AC joint with palpating hand while patient's arm is resting on the physician's knees. Internally rotate the left AC joint means the AC joint would prefer internally rotated position. Therefore, its motion will be restricted when you move the AC joint into externally rotated position. So for muscle energy, physicians will rotate the AC joint to its restrictive barrier at external rotation. Holding your patient at the barrier, physicians ask your patients to internally rotate. As the patients internally rotate their arms, physicians resist that force, creating an isometric contraction. Hold this isometric contraction for at least 3 to 5 seconds. Stop the contraction. Physicians externally rotate the patient's clavicle further to engage the second barrier. Once second barrier is engaged, patient is asked to internally rotate again, holding 3 to 5 seconds of isometric contractions. Repeat this process 3 to 5 times or more until the restrictive barrier is improved. Finish the treatment with the final stretch engaging the last barrier. Let's try treating the externally rotated AC joint with muscle energy. Physicians, internally rotate your patient's humerus until you are able to reach the internal rotation barrier. Now you're ready for patient effort. Just like before, instruct your patient to externally rotate while you're resisting its external rotation force, creating an isometric contraction. During this muscle effort, count at least 3 to 5 seconds in isometric contraction. Stop the contraction, then engage the next barrier by internally rotating further. Once you're at the next barrier, start the isometric contraction again. Stop the contraction and engage the next barrier by internally rotating further. Once you're at the next barrier, start muscle effort once more. Hold for 3 to 5 seconds again. Repeat 3 to 5 times or until the restrictive barrier is improved. Finish out the treatment with the final stretch through the last barrier.